your day.
How are you doing?
We are recovering from last week's pain. Not yet perfect. Every time you wake up thinking that it's going to be a better day, then you remember that you have to refer to the late Raila in past tense, and it's so surreal, man. Yeah, it's been terrible. It's been terrible the past 1 week or so.
It's difficult.
Yeah.
You would not forget, but the more days that pass, it will make it easier to deal with.
The other day I said that yes, sure, time does heal the pain, and the grass will definitely grow. But we pray that the memories won't fade. Yeah, in our every single day of life, we'd want to honor the memories of the man that meant so much for so many of us. Yeah.
Well, we're going to get into some of the things that he fought for. Also, especially concerning the health ecosystem. Before we do that, Dennis, we'll welcome you with today's proverb.
So today we are in Cabo Verde, the home of cachupa. Cachupa. But cachupa in this sense is a mixture of different foods. So it's a national food in Cape Verde. So it is a mixture of slow-cooked stew of corn, beans, fish or meat. So it is their version of tumbukiza.
Githeri.
See?
That's what I said.
Together minji umemaliza story. Yeah, and these beautiful people today, actually it is one of the few countries in the continent that is it is out of poverty. It is in the second level, yeah. So perhaps maybe many African countries need to learn from that. But let's go to our proverb. Every cat has a taste for a mouse.
Every cat has a taste for a mouse.
How would you interpret that?
I think it just it speaks to about our natural probably prejudices and biases, that probably we all have certain things that are inherently in us, that even if we were to try to move away from, be it our cultures, where we come from, you can never run away from it. And of course, some other people will then say that if the cat wants to become a lion, it has to give its appetite for rats and mice. It's about who we are as a people, what lies under us as humans, or something that you can't run away from it. And I think that's what I think.
Yeah, you can't run away from it. It's going to come out eventually.
Yeah.
One of the other things that we can't seem to be able to run away from is, the state of health in the country. Normally we have a Healthy Friday conversation and we look into particular health issues. But now there's an umbrella issue that we then also want to look into and see how things are progressing and if things have changed. About a week ago, we did see SG Dr. Tella say, you know what? If things are not sorted out in one area, if one finger is hurting, then all of us are going to shut this thing down and we're going to join everybody. How are things so far? If we look at just what was happening with striking doctors in one county, if we're then going to touch on, unfortunately, what we saw happening in the Health Committee of Parliament when the CS was summoned to answer particular questions, and we can go into that in details, to then what we saw when things seemed to be grinding to a halt in terms of the provision of services, at least at the private hospital level. What's going on now, Dr.
So, first of all, thank you very much. And I really want to thank Spice FM and Channel Media for always bringing up this issue around healthcare. For a long time, as a union, we have always tried to make Kenyans consider healthcare as the most important thing that you can talk about. Yeah, I know Kenyans prefer their politics, they prefer all these other issues, economies and education, all that. But I say that health is everything. Because we all are potential patients. Yeah, we all are going to die someday and nobody's coming out alive, and you can either die in your sleep or out of illness or an accident. So when it comes to matters healthcare, for a long time people made it a very private thing. That's about your family, and you guys will just suffer alone with the illness, and then when somebody dies, you grieve privately and all that. And the politicians would look like, what has the highest? Politicians look at issue about the political dividend, the votes, and all that. And so for the long time, we're like, oh, look, I built roads, piped waters, and all that. But then you tell them that, but these roads, if you don't fix healthcare, will just be used to carry our dead. These taps, if you just bring them without sorting out our health, you just use them to feed mourners. Yeah, these issues, you talk about schools, we just be burying professors anyway. Yeah, so health is a very, very important thing. And of course, even when we juxtapose it with the recent tragic happenings of Baba, people are wondering that, why did Mzee have to go to India? Could not have been done by Kenyan doctors. So every single day we are facing the reality of healthcare. And it doesn't matter whether you are middle class, you are poor. It doesn't matter, because you never know when you'll need that healthcare. Yeah, you heard about the MP, I think in Western Kenya, who got an medical emergency, and when they went to the nearest health center, there was nothing. Yeah, or the president in Malawi who needed just some life-saving drug, and the country's largest hospital didn't have the drug, and he lost his life. So yes, it's important that we talk about it. Our middle class, we have insurance covers, and sometimes we say that we really don't care about the public health care. I'll go to my private hospital. But when you're from Masai Mara with your family and you get an accident, God forbid, in Narok, you are most likely going to end up in a public hospital. You heard about the South Africans who got an accident around the Machakos Junction, and their wonderful cover, which will allow them to be lifted to South Africa. The first place they ended up to was Machakos level 5. So it's important that we talk about healthcare without thinking that we are safer because we can access an alternative form of healthcare. And so lately, there have been development in the healthcare sector, both positive and negative. And I think the most important development, of course, has been the issue around the financing of healthcare. Because when you look at the pillars of UHC, and I'm glad that UHC, if now everybody talks about UHC, whether we all have different meanings for it. Some people think that it is Bora Afya, yani you just go and anything. Others are saying it's Afya Bora, that I really need the care that I need at the right quality, at the right cost. Whichever way, people are talking about the UHC. And just the fact that we are talking about it means that we are in the right place. Now, how to end up there and is what has always been the issues. Yeah, because KMPD says that, yes, after you have built the hospitals, and counties have done a good job building those hospitals. In fact, we are saying that we have even surpass the WHO recommendation of the population per infrastructure of a hospital. Within 5 kilometers, there's a health facility.
Right.
Yeah. That's a building. Yeah. Then I'd like to tell them that, then stock them up and put the equipment and all that. Yeah. Then tell them that after that, you have to hire people to work there. Building a dispensary in my village with one nurse who, when she falls sick, it is closed. From 4 p.m. and weekend, it is closed. When she has an emergency, it is closed. Then you're not helping these people. Yeah, you have to hire people to be there, and not just hiring. You have to hire people with the right skill mix. Having 5 doctors, nurse, you have not helped them still. You must have the doctors and the nurses, the lab officers, the health records. That kind of mix has been something that KMPD talks about. Then KMPD says that, look here, when you have built, stocked, and you have even put the information system to keep the records and data, and put workers, then somebody has to pay for it. There's nothing called free healthcare. And that's what people get wrong. Because, of course, the politicians, and I even had the president the other day in Kitui telling people, usilipe, ukiambiwa ulipe and reporti. There's nothing like free healthcare. Yeah. Somebody must pay for it. Yeah, somebody, whether it is being paid for through the taxes, whether it is being paid for by donors and loans, whether it's being paid for by private insurances, whether it's being paid by social insurances, somebody must pay for it. And whether it's being paid from out of pocket. Yeah, and that's the debate that Kenyans have been asking themselves, that how do we fund our healthcare? And people talked about, let's do NHIF. Others said, no, let's do SHA. Yeah, and even the debate you talked about the parliament. The idea is nobody's fighting about that UHC is good. People are saying that, is SHA working for us the way we intended it to work for us? Yeah, the people are saying that, yes, it's working, but it can be improved. That's why I say that, no, it's perfect, it's working. Then another quarter is saying, this is terrible, the worst idea. Yeah, and so we can always check those positions, that somebody who says that SHA is not working, are they being honest? No, right, I've really found something that I really find really unfair and disheartening around us Kenyans. Of course, we know that sometimes in the politics we can get toxic and all that, but we must never refuse to acknowledge when something is good and when something is bad. One thing for sure, for example, in SHA, that the 3 funds, and I've come here before to explain the 3 funds. The government has done a poor job in explaining to Kenyans what these 3 funds stand for. The primary healthcare fund caters for the dispensary, the health centers, some county hospitals. And that's where it's a tax-based fund that anybody who pays taxes in this country must access that care for free. And I suspect that's what the president meant when he said, ukiambiwa ulipe ripoti. Because any level 2 and 3 should not charge anybody who is a taxpayer. The only thing you are being told, just register to show that you are interested in enjoying this fund under SHA. Then the second fund, which I know works, is a SHIF fund. So Social Health Insurance Fund, which is just the NHIF with just a different name.
Which you pay for.
Yes, which you pay for, you contribute for. And this is what now kicks in during admissions. And so when somebody says that SHA is not working because you are made to pay for outpatient, they're right, because SHIF does not cover for that outpatient. It's under the primary healthcare fund. But when somebody then comes and says that no, it worked. My child did surgery and it paid for it. They're also right, and and you have to acknowledge that, because maybe that's the fund they interacted with, the second fund. Then you have the third fund, which is the emergency chronic and critical illness fund. That is now when you have been admitted, then you are said that now you can go home, but you have this chronic disease, diabetes, hypertension, kidney failure, cancer, and all that. Then that third fund kicks in. When you go to ICU, that's the fund that kicks in. And initially it was kidogo, it was less, because like ICU, they're paying 4,000. Now it's paying around 28,000 per night. So it can help on something. Of course, it does not fully cater for the needs. In this country, we have a 55 billion shortage in healthcare funding. When you add the taxes, when you add the donor funds and the SHA, it's a 55 billion shortage. That 55 billion shortage must be paid for by somebody. And that's what you told Nilienda Nikamboni ongeze pesa. Because the politician wanting you to join the SHA told you that it caters for everything. They didn't tell you that there's a 55 billion gap that you might have to chip in. And the SHA is not meant to make you walk in and out for free. SHA was only meant to stop you from selling land, to stop you from selling your only cow, to save your life. SHA was only meant to stop you from dying because you're poor. So once they have saved your life and saved your shamba, then you have to top up something little to cover for that. So when Kenyans understand that, then the back and forth, the fights you will see in parliament. And sometimes those fights are very unfair, because politicians, they are the same MPs who sat and passed this law. KMPD gave a 25-page memoranda on the issue that wanted to be fixed. Those guys passed it, and I remember Nakumita saying that at a comma, ajabadilishwa. So I find it very unfair when politicians now go to media, go to platforms, and they complain about the same SHA. Why can't you go and propose amendments to say
the legislation that you passed?
As me, nimeona kwamba this and this and this is not working, so I'm proposing these amendments. Then I want to see which MP will oppose those amendments. But just to join us on Facebook and Twitter to get clicks and views to show us you're working. You're not working. Your work is in parliament, not on social media.
You know, Dennis, you've packaged this communication on what SHA is and the different cadres that it comes with in such a manner that anyone would be able to understand it. But that is not KMPD's work. Fine, you can still explain it, but this is sole responsibility of the government of Kenya through its communication channels to explain what SHA is, where it works, and what it does, so that Kenyans understand. But as we speak today, there is also the aspect of fine. Mheshimiwa alituambia to register. I registered, but hakuniambia nilipie SHA. You know, so at the end of the day, fine, I'm registered, but I have not contributed such that when I end up to a level where my contributions then needed to be seen, I do not feature in that conversation. So me as a registered person, rightfully so, haijafanya kazi, but kumbuka mheshimiwa hakuniambia that I need to pay up. So is it a question of the leadership of the country, talk about the political class, who are not telling Kenyans what ought to be done? Because you're also talking about a system where we have 22 million registered people, but only 6 million pay for it.
Yeah, it's true. It's true that sometimes, for those of us who have been around long enough, we first of all faulted the funding model that was being used under SHA, because we felt like for a country where the majority, 80% plus, are in Juakali, unemployed, and all those kind of stuff, how to enforce people to pay Yeah, Kenyans are people that even if you told them tomorrow's deadline for KRA filing, some of us will still not be doing it.
We want
You get that?
extension.
Yes, there must be something. And I remember the first proposed bill, it talks about people being denied the public services if you don't pay up. Of course, KMPD challenged it in court and we won, and it was removed because every taxpayer has a right to access government services. Yeah. But then again, we could have found alternative ways of ensuring that we are able to fund healthcare. As we propose tax-based, that you just tell us, there you do the roads, that if you fuel X number of liters, this amount goes to fixing roads and all that.
Yeah.
Same healthcare. Would have just said that, look here, we are going to either do for the sin tax, that if you're going to the sugars, the salts, the alcohol, and all these things, you're going to introduce something on it. Or just a portion of the VAT, like in Ghana, that's what they did. Yeah, so that everybody pays taxes. Yeah, but then again, the debate and the decision to go through a social mechanism will carry the day. But then the headache now comes that beyond registering, and this is where now the challenge comes in, that we have politicized. Well, it's a good thing to politicize healthcare because now the votes, the value is being seen. But we've politicized the debate in that those who wanted to make political mileage out of it, see that it's not working completely. Yeah, and in the desperation for government to flip the knee, they also went in the politics and got lost, where they told guys, just register, you don't even have to pay. Yeah, you know that thing of advert, then you got T and C's up chini. They never told people the terms and conditions.
Terms and conditions apply.
Yes. So when people say they're not working, it's because you're the one who sold them the wrong thing. But if you told them from the word go, the truth, if you're not desperate to have them register no matter what, yeah, if you stopped making it look like more registrations than 25 million is a success, tell them that yes, you have done a good job registering, but payment is the ultimate issue. We need this money, and this money is that today you are not sick, but it will cover for somebody, so that tomorrow when you are sick, somebody else can pay for you. People could have understood that. Also, as Kenyans ourselves, we also need to search our souls. Are we really honest people? When you own a hospital and you see somebody coming with like a small swelling, a lipoma, and you tell them that we'll do it and I'll bill it as another form of surgery, upcoding. This money is finite. It's not that it's some just endless pool. So the moment you keep on tapping into it, it's going to run out. Finally, Kenyans are saying that yes, even if I registered and paid up, I go to the hospital, I'm told to go buy drugs outside. I'm told go do an ultrasound outside. I'm still told that we don't have this kind of investigation. So you ask yourself that if I already paid for almost 1 year, like for the guys in the informal sector, why again do I have to come and be sent to a lab or a pharmacy outside? Mark you, when they are billing SHA for your admission, they bill full investigation, because in that package has investigation and drugs. So bado umenunua dawa nje, umefanya ultrasound nje, umeenda lab nje, na wakiclaim, they claim full amount. So we have to challenge government that beyond just telling us to join SHA, you have to tell us also what is going on in those hospitals. And I challenge governors that right now the national government is taking the hit on SHA, but it is the county facilities that are breaking people's hearts by not having functional hospitals. The strikes we hear about, the complaints we hear about, is because people don't see the need. Even I can put a theory that even people refusing to join SHA would pay up. It's because hakuna haja, ukikuwa mgonjwa bado utaambiwa upige picha nje, ununue dawa nje. So can we have a functioning public healthcare system? Because the flip side also is that Kenya, 60% of us rely on private healthcare. Okay. But somebody who does private healthcare is in business. I don't say that it is not out of the goodness of the butcher that he sells meat. He's in business. So as long as somebody opened a facility with a profit mind, SHA can never be enough. Because SHA is just preventing the basic survival, not to sell, not to die. But if you come here that an ultrasound that would cost 1,500 in public is costing 6,000, SHA cannot pay for that. Yeah, and that's why we must find ways of driving the numbers to public hospitals by making sure that public hospitals work. But when you force somebody, I'm a businessman, I've opened a facility, I'm seeing your patients, but you're not paying me. First of all, the amount you're paying me, even if you paid me is less. Then after that, you have to delay with it. I can't predict when you'll pay it. So you have made me an underwriter. Yeah, you have made me an underwriter. People say that SHA is working because I went and I was treated, but I'm left begging you to pay me. Yeah, so you have to ensure that if somebody has to go to a private hospital, let them initially choose that, yes, Shah will pay half. But since I want more comfort, I want better meals or something of that sort, let me go. But let people not go to private hospitals because they're desperate to survive and live. That if you go to public, you're half dead or good as dead. Because right now the tragedy in this country that patients are going to private hospitals, not because of any luxury or anything, but because they know that if they go to the public hospital, they might die. They'll have to queue the whole day because they're not enough healthcare workers. They have to queue the whole medication because you have to stay complicated because they're waiting for an investigation that never works because there's no equipment in that facility. We must fix our public healthcare system for Shah to work.
Dr. Miskela, from what you're saying, it's very possible to fix it with the resources that are available and with the minds that are functioning within this ecosystem. Right? That from the formula that you're giving, if you use a tax-based system whereby if a certain amount of money is paid for a certain thing, then you can actually glean the resources from that and fund the system.
Yes.
So it's possible. You don't need some extra galactic force to come in and sort out the issue.
We just need to be prudent with the funds. For example, how comes that when it comes to building the facilities, the counties and government has done a good job and achieved the WHO recommendation? Of course, the motivation is that there are those kickbacks in the constructions. Yeah. How comes that when you look at the payrolls in this country, we have ghost workers in those counties? How comes that we have people at non-medics being paid under payslip for medics? How comes that when doctors resign or die or leave, you use that budget to hire non-essential clinical staff? Means that the money is there. People are just applying it wrongly. Yeah. How comes that we have KEMSA throwing away drugs, that drugs are expiring, yet drugs are not existing in the facilities? Yeah. How comes we paid 64 billion in the managed equipment scheme, Uhuru Kenyatta, for a 7-year lease for equipment that never helped anybody? Yeah. Means that the funds are there, yet they're just being misapplied. Yeah. So if we could just for a moment say that, okay, we are greedy, we are corrupt, but let's not touch healthcare. Because this one will also catch you as a person. You know, the good thing about death is that it's an equalizer. Hakuna mali atasema kifo ya tajiri na maskini tofauti. The heart stops beating the same way. Yeah. So if you could just say that, let's apply this thing correctly. If the governors would for a moment think about them partake of what they are prescribing, because it's funny that governors insist that healthcare is devolved, we are autonomous, blah blah blah. But when they fall sick themselves, they come to Nairobi. For the cuts, they go abroad. It's very unfair that you're a father, you're a mother, you fix a meal for your kid. They say, don't, mommy, we're tired of hii mambo ya mboga kila siku. Kumbe wewe unajua lifetime ukiwa kazi ushakula kilo moja ya nyama. Unaambia vegetable good for you. Lakini wewe yeah, that's what they are doing. They are fixing for the family a meal that they don't partake. So unashaka kwamba mzazi kama yeye ako one meal omad. Kumbe alishakula nyama kilo moja. We have to be fair to the people. You can't, I keep saying that it's like a baker who bakes bread for the village. Then when people are coming to buy it, then I don't know, mkati in the next shop. Governors must know that being a leader in the county on healthcare, then it behoves of you yourself to partake of what you are giving your people.
Should it be law?
Personally, I think that we have no Kenyans who, if you tell them, we just say, you know, we must say that let every public officer, also just partake Shah, partake public hospital. But if you want to go private, then we must stop funding private insurances. You know, right now our taxes is what is being used to pay for these public officers. Very, very excellent. 10 million. In fact, it's very unfair that is MPs who make for us some of these bad laws. They have 10 million outpatient covers in any hospital in this world, in any country. Yet the same people that are making law for have just to pretend with this kind of small thing. When somebody says that no, you cannot go to India for and Shah won't pay because of 1, 2, 3 reasons. When they fall sick, the first place they go to is abroad. We must find ways of making sure that when you are making those laws, you are also partaking of those laws.
Dr. Are we really not serious, really? Are we really being authentic when we say that the healthcare in the country is not working? And why am I saying that? It's because you look at the entire ecosystem. So here we do not have drugs in hospital, but KEMSA is throwing away drugs, right? We have facilities that have been built. We do not have equipment, but there's a lease program that was put in place that bought equipment, have been installed, but we do not have officers who can run these equipment, but we have those that the government has trained, but we're just not hiring them, right? We have all these facilities that do exist, and the leadership itself, like you've said, do not want to go to these facilities. Seems as if these public health facilities are meant for our two. But for us, we have places that we need to go. And with that, healthcare will never be fixed because they never use it.
Yeah, you got it perfectly well. That we have this artificial glut. Or shortage, if I can say that. Where you have no doctor in the hospital, but you have 6,000 jobless doctors hanging out there. Where you have camps are throwing drugs and there are no drugs in the facilities. Where you have buildings in place with no workers. Where you have 64 billion spent with no equipment to show for it. Yeah, that is true. And worst of all comes in when people decide that this social function, this social responsibility of government is going to become a business opportunity, an economic venture for certain characters. These characters, sadly, some of them are the same politicians and leaders you expect to change healthcare. Yeah, themselves, they want this public healthcare to fail so that they can go to private hospitals that some of them own. And that's the tragedy in this country. That the same character, the same MPs, the same people you expect to fix public healthcare and healthcare in the country, and the same people who own these facilities. No, from NHIF days, people knew that it was a cash cow. Everybody said that, forgot to a clinic too, utapata pesa. Even people could approach me, anyway, daktari, I'm not a doctor, but you got a license to funguka mali tuchukue pesa ya NHIF. In fact, that's why you can even see most of them, the people who complain the most about SHA are private hospital owners. I know they have genuine concerns about some of these bills that have not been paid, but some of them are just missing the good old days when money was flowing from Upper Hill to their pockets. You get that? So I know they are missing that definitely, despite also having genuine concerns. But yes, when we say that healthcare is not working, sometimes we are not being honest, but sometimes we are also genuinely raising concerns. Yeah, and this is why we say that and you know something about healthcare is very personal. Yeah.
Yes.
Wewe kama ulienda ukatibiwa ukasaidika, that's your story. For me, if I had my appendicitis naumwa na tumbo and sikusaidika, it's not going to work. And I have all the right to say it did not work for me. So the question should be that, then when do we balance the politics and the reality of the ground?
But if we look at a factory where shirts are being turned off that thing over and over again, when the people who are sorting find a shirt that maybe the collar wasn't sewn right, do they say, take this shirt and take it back to the back end where people are sewing and then put it back on the turn? Or do they take the whole thing and reject it?
Yes, of course, sometimes they just reject the whole thing. And in fact, their analogy sometimes is unfair because then they'll say that easy will discard and sell cheaply to the locals and all that. And that's what some people are still doing right now. When you talk about poor healthcare for poor people. And bora afya. You get that? Where the governor will come with a huge load. He says, nimeleta dawa.
It's an activist mentality.
Kumbe ni paracetamol ameleta. But ajali kwamba ameshapiga picha kwa social media kwamba alileta dawa. They don't care. Somebody says that, yes, I bought an ambulance. It is broken down, not working, but they don't care. Mimi nilishapiga picha, nilinunua ambulance. Kama imeharibika basi ni hao daktari wanaiba madawa, wanaharibu hizi vitu. Unaelewa? So yes, we have to, if our leaders felt the pain of our people, until you have a patient die in your hands or miss their chemotherapy because SHA is now paying 600,000 when NHF was paying 1.2 million. Yeah, until you see a patient missing on medication because there are drugs that SHA does not cover in this cancer treatment, or missing their dialysis because they need more and maybe SHA covers only two. Until you see families having to meet to say that, where do we go to from here? Until you hear about this, and I keep on saying these stories every day, that some of these stories might look very distant and theoretical, but today, somebody will wake up with a sick child. And probably this is just a poor woman in Kilimani who does the laundry stuff in Kilimani. So they have to sit kapo kando ya barabara to get their daily bread. Maybe she has 3 children. So this one is sick. So she wonders that, do I take this child to Kenyatta? And Kenyatta will have to queue the whole day and probably tomorrow morning. And if I do that, these other 2 kids are going to starve because I have to earn my daily bread. But then again, if he had to go and do the fua, then take the baby in the evening, maybe to Kenyatta, then you come back from kufua, unapata mtoto wako amezidiwa ama amekufa. These are realities that women portend with. And that's why you see they have to then go to these nearby estate clinics, which are largely just hotel facilities. The only thing they have is that you won't queue in the line or you won't be sent for a drug outside. But there's nothing meaningful, because now if somebody decides to fill in that void, you get that? And by the time they're coming finally to be seen in a proper doctor, the complications, this cervical cancer that was stage 1 is now stage 4. You have to spend more to treat it, or you have to lose this poor woman because she had to seek this poor medicine where she could get that convenience for the moment. You know, so we have to really feel the pain of people and do something around it.
Daktari, even as we have to feel the pain, the question is, do they really care? Because Kenyans have spoken, doctors have spoken. I remember when Secretary General Ms. Keller was speaking on the situation on how Atela Davji was speaking on breaking down on how patients are dying in hospitals, you know, and no one seems to really do anything about it. You look at how many people are burying their loved ones, are going through difficult times to just access healthcare. I know I have a friend of mine who's struggling to raise money to get chemotherapy. You know, it is not easy. But these are stories that politicians, leadership go every day to these matangas, to these harambes every day. But nothing seems to be happening. I'm just asking, Doctor, do they care?
You know, WHO is very smart. After WHO put the 4 pillars, we talked about the infrastructure, the ICT technology, the pharmacy, the health workers. WHO added an overarching pillar called leadership and governance. That after you have put all these 4 moving parts, somebody must offer leadership and governance on these issues. Governance, can talk about the corruption and all that. But more important on the leadership is that have Kenyans taken time to ask themselves that 10 years plus after devolution, is it working for us? Is it working for us as it was envisioned to? Leave the politics aside. Because in 2013, when Uhuru Kenyatta told governors that let's do a staggered devolution of healthcare, let's maybe do per county and see how it happens, or let's do level 1, 2, 3, then observe, then do 4, 5, 6. They said, no, you are fighting devolution. It was as well Isaac Ruto. And Uhuru said, Sir Chukweni. And KMPDU has consistently said that it's not working. The devolution of healthcare is not about you telling me that Wajir never had a cesarean section, now we have done it. Oh, Mandela, we are now doing the dialysis. No. It was never about those lofty dreams. It was about basics. That, can I just not die? Whether it's from malaria or from cancer, can you save me for that moment? And we keep on saying that until we relook at how we develop our healthcare. And that ties me to Baba, the late Raila Odinga. When we told him this is not working, in BBI 1, he said that, why can't we solve this by trying to take away mambo ya hii healthcare workers? That looks like the most difficult part, the most expensive part in this division of healthcare is the HR. They're very expensive to pay. Counties almost spend 80% of their budget on healthcare. And out of the 80, almost 50% goes just to paying salaries. And I keep on telling governors that it's nice, you feel like, oh, doctors are begging you, demonstrating, you're feeling important. Yeah, you have slots to hire ghosts, you have slots to be paid to hire people. That's why they're insisting on holding the HR, because they want to put their ghosts, their supporters in the payrolls. Yeah, they want to be bribed when there are people hiring healthcare workers. They want to look important. But to tell them that you are being conned by somebody giving you 10 billion in a year, and 80% of it goes to healthcare, and more than half of that goes to paying salaries, you're being conned. Let these people, this health service commission that we proposed, run the HR, lipe watu mshahara, andika tu kazi, transfers and all that. Then get real money for doing the real job, for building the hospital, for buying the drugs, then can change people's lives.
This Health Service Commission has been in the conversation
Yes.
for very many years.
Yes,
We're not talking
in fact,
about
it was there in the
cycle.
initial Kilifi draft.
Indeed.
It was there. It was not removed in Bomas because they said that there are too many commissions.
So why is there no appetite to because it is clear the teachers have one, and it's clear we're not mixing HR issues with functional issues, whether it's at county level with ECD or then we're going now to the national level. It's clear, the demarcation is clear. So what is there? Is a political skew to not wanting to have a health service commission in place?
It is just in Kenya we play very cheap politics. Because look here, if the teachers felt they need a commission. The judiciary saw the need for a commission. Parliament saw the need for a commission. The police even have a commission that they don't need. They're fighting over it over nothing. In fact, I wish they could give us that commission. You get that? But it's only because people want to, this selfish guarding, and you're guarding nothing. Yeah, because you're a governor, and it's clear that you're unable to employ doctors. You're unable to promote them. You're unable to pay them on time. You're unable to give them medical covers. You're unable even just to facilitate amongst yourselves inter-county transfers, that if my mother is sick in Kisumu, I can transfer and go take care of her as I work and serve people of Kisumu. They are not been able to do that. And it's simply because I told that when BBI1 was there and Raila, the late Honorable Raila was keen on fixing that. It is a very, very government who went and blackmailed him and told him that if you put HSC in BBI1, we are not supporting it. And in BBI2 it was removed. Because those selfish reasons. The same thing that they tell the president when he tries to comment on that issue. When Duale tries to step in on issues of even Kiambu, they say, no. You cannot prefect us. You cannot police us. Yet the labor standards in Schedule 4 of the Constitution say that is a national issue. You cannot on one end pay doctors this amount and promote them in one county. My same classmate in another county has never been promoted, never been paid. Yeah, and that's what brings that confusion. But I wish that maybe in the second term of the president, God willing, if he ever gets there, when he has nothing to lose, we can face Kenyans and ask them that, is healthcare working the way it is? My proposal, if the governors insist that they want to continue handling the H function, then why can't we then say that level 1, 2, 3, waachiwe, they handle it. They have done a good job with ECDs. Because that's within their abilities. That's within the ability of the talent of the people in those counties. They can handle these ECDs. But making them run level 4, 5, 6, or 4 and 5 is like asking them to run a university. First of all, how do you manage professors in that university when your chief of staff is, and I have nothing against teachers, is a retired primary school teacher or an ECD teacher? It's beyond their scope. But if you allow them to do ECDs, then at a certain level, somebody else takes. Same thing, level 1, 2, 3. They can dehome kids. They can talk about hand washing. They can run those CHPs in the hundreds of thousands. They can screen illnesses like in Cuba. Then when now it gets to the point of life and death, now the curative medicine now, you let the national government kick in. And you can see them, some of them inadvertently by begging for level 6s to be taken, like in Kisumu, UTRH is now level 6. I'm seeing Bungoma has also surrendered their county referral hospital. Mary is also asking for one. They are finally acknowledging that probably what they thought about healthcare initially, for them, they were looking at healthcare from the point of when they walk to this private hospital, this big hospital, they see money flowing, they are paying bills of 2 million. They thought there's money here. But no, healthcare, just like all social functions, must be loss-making ventures. The moment you start making profits in healthcare, somebody must suffer. And that's why public is suffering, because even in those county hospitals, they still have to make profits.
You see, Daktari, the way you speak, so here we have the counties on matters to do with healthcare. But when one way of dealing with all these problems is by sitting down and having this conversation. And I ask the question, when is the last time these leadership levels of government ever sat down with the doctors to just, let's have an honest conversation on what is ailing healthcare? Let us find solutions to that. Or is it a question of, this is our part, we will do our part, Nini Madaktari, and then Mutibu Wagonjo?
Yeah, and that's the key saying that this man, Raila Odinga, was a special man. And we're not saying this because he's dead. As KMPD, this is somebody that we worked closely with when we were solving the issue. Because like when Shah, we were making it around Shah, remember he sent his people and told us, can you just do for me a 2-pager on the issues? And see some of these issues, I see these 2 piecemeal reforms being done. I bet that maybe he went and then quietly talked to the president and they are able to adjust them. Yeah, people we have leaders who are not keen on sitting down unless there's a crisis. When you see us going on strike, not because we like abandoning our patients, but because you keep on talking and talking and talking and nothing ever happens. Like the Kiambu strike now on day 151. For 2 years, you have been talking, begging, signing agreement that they don't implement. Finally, you do a strike, then somebody says, now let's talk. Yeah? These very, very guys even hold summits, governors and presidents. They even they had a health summit. How can you have a health summit that you invite everybody except healthcare workers? It's funny. It's not even funny. How can you need to talk about healthcare workers? I don't even see the need to bring the most problematic part of this whole ecosystem, the healthcare worker. And so that decision not to talk is something that I wish every leader, every public servant would wake up to that. See, the day you wake up in the morning and you have your targets for the day, that my boss expects 1, 2, 3, the company expects 1, 2, 3. If people woke up and say that today I'm going to solve the internship problem, today I'm going to solve this problem, then we will solve these issues. We'll sit down and solve the issues. Sadly, people have not been able to do that. And that's why I'm happy about the healthcare debate every Friday and this in every political space. Because finally, in this coming election, healthcare is going to be a very, 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 very big part of conversations. Whether it's at the MP, at the governor, and whether at the presidency. I keep on saying that SHA and healthcare what will probably make or break the Ruto campaign and dreams. Because once I've lost my loved one because of a failed healthcare system, whether unipatie pesa, CAA empowerment, whether unipatie lesson a t-shirt, I'm not forgetting that my mother died because of the failed system. If I have to sell my only cow that I'm milking to pay a bill for my sick child, my cow is gone, Even if you gave me 1,000 bob, build me a church, I'll think about I had to sell my cow to take care of my child. So this healthcare thing is going to be very, very important. And as KMPD, we are not going to shy away from, in fact, we are going to literally endorse candidates and also blacklist certain characters in the coming election. We tell Kenyans that on this one, this guy has failed. On this one, this guy is tick. Because I think that until we put that value, that political value on healthcare, they will never want to solve it. They'll keep on telling us about the first Syrian section where, they'll tell you about the first war done where, which is neither here nor there. Tell me, as Miss Keller, if I fall sick, can I speak the same way you speak about that first Syrian section? And some people say that, before devolution, there were no doctors, only had 2 doctors, now we have 20. What makes you think that maybe it's just because Kenya developed? Maybe without evolution still, because Kenya has grown, still just like in education. Before the evolution, there were certain things which have now improved without them being devolved. So we have to stop blackmailing Kenyans and blackmailing healthcare workers who are asking for more. And we're asking for more because we know that we have no other option. If we had another option that I can do this, I would not have to worry about it. I would say that as I'm a doctor, I'm sorted out. Yeah, but we know that even if I was sorted out and my mother is not, I'm in trouble. If not, my mother is not in trouble, then I have to find ways in every other WhatsApp group for my sick friends. So we have to really, really push our leaders. We have to blacklist them from those funeral podium. Because why would somebody not have hospital working, whether you're an MCA or an MP or a governor or senator, but then when these poor people die in this accident, that there was no first aid or such a theater working nearby, they have the guys to come, stand on the podium, campaign and give you 20,000. It's not fair. It's not fair.
Is it? Sometimes when we look at the burden, because it's a huge one. I mean, for anybody in any country which has a health system that's at the very least functioning at a very basic level has carried a huge burden.
Yes.
Right? And whether it is constitutionally bound, it still has to, or not, it's got to do its job. Is it possible that because we're seeing so many fissures, is it possible that the burden is too great for government as it is currently to handle? Are there too many people? Are there not enough resources? Is there not enough infrastructure? What's the problem? Because we seem to not be able to get ourselves wrapped around it.
There's just too many moving parts. I keep on saying that you cannot run the healthcare of a country in 48 different ways. That every governor does his own things. Huyu anakuja Oparanya anakuja anaanza kujenga level a building in his 2 terms, he does now finish it. Then huyu mwingine anakuja anasema no, me I'll go and finish Malava sub county. That's what I want, because ile ingine 10 billion in Shapot, I also need to have my own new project. I won't say that they did that. I'm just saying that the thinking that some people come with. So they have this half field, kila mtu anakuja na yake. They know these governors, at least I thank the voters, they don't have that security of quote tenure of 10 years. They have 5-year tenures. So somebody comes, those 5 years, they have to do it, they have limited time. So they just do something, then 5 years you are gone. Somebody new else comes again, says no. For me, I don't want this, I want this other one. Then you have the level 6 is also everybody coming with their own idea. I want to be a cancer center, I want to be a ward center. Then they're done. Then the national government comes and say that no. For us, this is our priority area. So we have all these crazy ideas in these 48 different ways that nobody can even handle. You hear somebody say that, we only have 9 oncologists in this country with cancer burden that we have. They're telling you that why can't we train more? They say, no. In Nakuru have 20 OBGYs, I can't allow more training. Yeah, they know that the OBGYs have to then do the oncology. Yeah, someone says, no. For me, I don't want to train more surgeons, I have enough. But another county has no surgeon. So you have all this mess up. You have one OBGY in Migori, or 2 in Homa Bay, and 20 in Nakuru. Yet the same taxpayer in Nakuru and Homa Bay pay these people. People have refused to be creative around it. Yeah, we keep on telling that you cannot run healthcare in 48 different ways. If you found education too important to devolve it in entirety, if you found security too important to devolve, yet the most important thing which ties all these things in healthcare, then you just casually just dump it, and governors don't want to be held accountable. Anytime you try telling them anything, hey, you're trying to prefect us, don't tell us what to do. As in, something has to give. And the president must know that for us as Kenyans, we'll blame him. Me, I'm not going to start blaming my governor when healthcare fails. Because we only gave one person the sword. The rest are just given Bibles to swear. The only person who's supposed to chop the corrupt and fix a few things is the president. Yes, so he must do something around that. Kenyans are looking up to him to just beyond talking about sham. And I'm glad that he has made some reforms. The reforms in Kemsa right now, they feel it honestly. The drugs are being refilled pretty well. Only that the counties are not paying the debts. So counties are not getting the debts on time. We are the SHA with these holy cups. We are raising more money than was being raised by NHIF. Yeah, we just need to fix in the issue around the other 2 funds that are not well funded. The primary healthcare fund, we fix it, and the emergency fund. Then we are now good to go. The other issue is that the hospitals we have built enough for it. He has now brought the equipment scheme, which some people are faulting, some of us are praising it, because they are saying that if you bring this equipment, it's only when it works and the patient pays that you get paid. Now, ile kitambo ile ingine ilikuwa kwamba they put like in Embu where I worked, they brought for us renal machines, installed them there. We had no renal nurse, no renal physician, and for 2 years they gathered dust when we were training somebody to come operate them. That's no longer going to happen. Where somebody puts an X-ray machine in an orthopedic theater with an orthopedic person in place. So this equipment scheme, putting those things and paying for service is perfect. We are now telling that, yes, you hired CHPs, but when you hired CHPs, you just mobilize people to come to the hospitals. In the hospitals, do you have a plan to recruit healthcare workers, the right skill mix, enough nurses, enough doctors, enough lab, enough public health? Are we able to have a discussion on that? It's not rocket science. Other countries have done it. Why can't we just sit down and talk? Baba kept on saying that, let's just sit and talk. We might not agree, but just the fact that we have sat down and talked already gives us a pathway, can clear the prejudices, the fears, the allegations that we are having, those inherent things that we are saying that, oh, governor, this, if I sat down and you told me that I'm ready to promote you because of 1, 2, 3. You get that? If we all just sat down, but right now nobody wants to sit down to have a conversation unless there's a strike. Then you finally, KMPD finally forces them to come and sit down. But even those meetings, then you see the COG guys and ministries fighting on who should sit on which chair, on how big which chair should be taller than the other, who is more senior, the governor or the minister. Some of the things we see in those meetings are very, very pedestrian. You know? So we must elevate. And I propose that one of these days must sit down with the president and the governors and the ministry guys in one hall, a health summit, and with patients. They are also, we all have a conversation on how do we carry forward the healthcare. Kenyans must no longer die in foreign countries. Kenyans must no longer die in bad states missing medications. We must stop dying from preventable illnesses if we truly want to take this country to the next level. Yes, Singapore is perfect. Malaysia, those dreams are lofty and beautiful. But you have to be alive, first of all, to make it get there and to live long enough to see it happen.
And to live long enough to see it happen. I guess that's the one of the basic things that we talk about this morning. Of course, you know, not just a spirited conversation, but one that bears in it a lot of reality for where people are today. A lot of work needs to be done. And these conversations, at the very least, like you said, the conversations must happen. People need to be talking to each other, not roundabout and at each other, to get us to the place where we're discussing that people will then be able to say, yes, the healthcare system works. And that's some of the conversations that we have this morning. I want to thank you for being here, to waken us up to these realities that are there, and to then say, okay, can our conversations now start to shift in a different direction? Yeah, true. I agree with you. As I finish, just reflecting on the life of Baba, I promise to comment on it, that if we truly want to live by what he believed in, and if we want to we might not get another Baba in this world, and I hope we never have to get another one, but we must live by his ideals. He has to live within us. We must love this country more than we love anything else. We must love this country in that every single day when you see a problem, you must want to solve it. Because there's no other country.
we don't have to lose our loved ones, our children, because of things that have been done elsewhere before.
Yeah.
No, this healthcare thing is not rocket science.
Right.
The Scandinavian countries did it. The UK have the NHS. They have done it. So we just need to really be patriotic enough, love our country, and the spirit of what Baba stood for. Let's just not go just about what. Even the governors who I see wailing and saying he was the father of devolution, they must now, moving forward, live that dream and spirit
Of the
within
father.
them. Guys, thank you so much for having me, and may God bless our country.
Indeed,
Indeed.
Dr. Dennis Miskela is the Deputy Secretary General of the Kenya Medical Practitioners, Pharmacists and Dentists Union, has been here with us this morning. Thank you, Dr.
Asante sana.
At 9:01. Good morning.
News from around the world. 94.4 Spice FM.
This is The Situation Room, the only way to start your day.